Welcome everybody to Pittsburgh Medicare 101, our Medicare Made Simple Educational Workshop. As you did not hear before, I have exciting news, and that's for for the first time in almost a year, we're getting to go out in front of people live again, and that's one of the most exciting things we get to do, is meet people in person and share information about Medicare and see how we can help. And so pay attention to our Facebook page for details on that. That's coming up in April. Some of you can already type there in the chat bar what we normally do when we're doing these face-to-face live in community centers and libraries and places like that is we talk to people beforehand. So just go ahead and say hello, type your name. I want have some people typing hello now. Glad that you're all here. So let's see, we have Fred. Hi Fred, thanks for joining us tonight. See, Dr. Jim, thank you so much. Sue, thanks for joining us this evening. We are very glad to have you. Barry, again, welcome. Glad to see you all here. I'm not going to make you guys wait much longer. We're going to jump right into the workshop now and get started with this. And again, thank you for all joining me for Pittsburgh Medicare 101, our Medicare Made Simple Educational Workshop. So I want to go over some things that we're going to cover for you today so you all know that you are in the right place. So the things we're going to cover are original Medicare Part A and Part B. We're going to go over Medicare Part C, that's the Advantage plans, Medicare D, the prescription drug plans. We're also going to review Medicare supplements and Medigap plans. And probably the most important thing that we're going to go over tonight is how to get help when you need it. So, this is kind of the way Medicare is now. A lot of terminology, a lot of confusion jumbled up. It's hard to understand, and there's so much information. You're on information overload. As somebody turning 65, we had somebody that came into the office like a week or so ago, and this is just the mail they had gotten in the previous week. You can see there's a whole bunch of stuff here. It looks official. It looks important, and you don't know what to do. You don't know which way to turn. So that's exactly why we decided to conduct these educational workshops to help cut through the confusion. Now, we have to get this disclaimer out of the way right at the very beginning, and I want to share with you that this event is for educational purposes only this evening. We're not going to be going over any plan-specific benefits or details. So myself, Bill Cardos, and the team here at Pittsburgh Medicare 101, we are not connected with or endorsed by the U.S. government or the federal Medicare program. But what I can say is we are a group of insurance and financial advisors. We have well over 100 years of experience in the Medicare market, and we've seen all the changes that have gone on since the beginning, and especially over the last few years. So we've gathered that information together in this workshop that we're going to present tonight. And we like to say that we've seen the good, we've seen the bad, we've seen the ugly, and hopefully we're going to direct you away from the bad and the ugly and keep you on the path to good. And again, this is for educational purposes. I want you to sit back and relax just a little bit, because we're not going to try to sell you anything tonight. We want you to learn about Medicare and all the options that are available. Okay, so as somebody coming up on 65, you should have received this book. Pittsburgh, not from Pittsburgh Medicare 101, but from Medicare itself. It's Medicare and You. And you can see it's a very thick book. It has everything you could possibly want to know about Medicare in here. The thing is, it's about 138 pages long. It's written by somebody at the government, so it's not exactly the easiest read. And if you have difficulty sleeping some night and you have this book, go ahead and give it a crack it open, and it'll get you right to sleep. Now, what normally happens is this used to come about 90 days before you're 60, the month you turn 65, but there's no rhyme or reason to when it comes now. We've seen it come 5 months before, 4 months before, and we've even seen some people get it a month or so after they were already due to sign up for Medicare. So if you get it late, it's not really helpful. So everything we're going to go over tonight is what's covered in this book. We're going to touch on this just very briefly, the new Medicare card. It's been out for a couple years. You do want to pay attention that you don't throw this away. That's probably the most important takeaway from this, because you get so much mail and so much of it's not important that it gets to be a real easy habit to just like start chucking this stuff right in the garbage can as you're on the way in from the mailbox or from the mail slot in your door. So, once you get about 3 months before age 65, make sure you are at least opening everything. So if this red, white, and blue card is in there, you're not throwing it away, because if you do, then we have to go through the steps to get you a new one. The important information on this card is going to have your name, a Medicare number, which is unlike any other identifying number that you happen to have, and the dates that your Medicare Part A and your Medicare Part B start. So who here feels like they're this guy? You're standing stuck in front of the Medicare maze. You know there's an end somewhere off in the distance, but you don't know the path to take through the maze, all kinds of crazy twists and turns. Well, we're here to help you through the maze today. So again, we're going to cover Medicare Part A, Medicare and Medicare Part B. We're going to go over Medicare Part C, the Advantage plans, Part D, the prescription drug plans, and also Medigap. Again, and we like to joke, we have a map through the maze. It's our inside joke, but we really do have the easiest path through that maze. So what exactly is Medicare itself? So Medicare is health insurance for 3 groups of people. It's for people 65 and older, people under 65 with certain disabilities, and people of any age that have end-stage renal disease. This program is run and strictly administered by the Centers for Medicare and Medicaid Services. They have some very strict regulations on how Medicare works and how Medicare is presented. And in order to get Medicare Part A and Part B, you do have to be a U.S. citizen or lawfully present in the United States. So there's difference between Medicare and Medicaid. Sometimes people use these interchangeably. So again, real easily, Medicare is an entitlement and health insurance program for those 3 groups of people that we just mentioned: people 65 and older, under 65 with certain disabilities, and people with end-stage renal disease. On the other hand, Medicaid, it's a joint federal and state program. And what it's there for is to pay the medical costs for those people that have limited income or resources. And a person that qualifies for both Medicare and Medicaid is called dual eligible. And both of these programs are run by the Centers for Medicare and Medicaid Services. One thing I did not get into at the very beginning is we are going to have a question and answer session at the end. When we do these live, we normally just let you answer a question, but we found that doesn't work so well with the webinar format. So save your questions for the end. We'll make sure that we stay around long enough to get every single one of them answered. So we're going to go over the parts of Original Medicare, and this is all there is to Original Medicare. Part A is basically our hospital care for Medicare, and Part B is medical services, the services that are done by the providers in the hospital. And this is all there is to Original Medicare. Now, the important thing to know about this is if you only have Medicare Part A and Medicare Part B, it's not going to cover all of your expenses. So later on in the webinar, we're going to get into some types of Medicare insurance plans that will cover what Medicare Part A and Part B does not cover, and get those out-of-pocket expenses covered for you. So Medicare Part A, again, it's our hospital insurance. And for most people, there are no premiums due. And in order to get it for no premiums, you must have worked for a minimum of 10 years or 40 quarters and paid FICA tax during that time. Now, if maybe you didn't work 10 years or 40 quarters, but your spouse did, you'll get to qualify under their work record. And it's, it's for those 3 groups of people that we mentioned a little bit earlier on. Now, what if neither you nor your spouse worked the 10 years or 40 quarters? You can still purchase Medicare Part A, and that premium is determined by Medicare, and they'll let you know the amount that you owe for that based on the number of quarters that you actually did work. So what does Medicare Part A cover? So in the hospital, it covers the cost of a semi-private room, your hospital services and supplies. It covers meals. It covers general nursing supplies and all of the blood other than the first 3 pints. If you need inpatient mental health care, it will give up to 190 days of lifetime coverage. And it basically offers coverage in 90-day blocks, okay, 90 days per quarter. And now if you need more than 90 consecutive days in the hospital, okay, so that's more than 90 days in a row, there are 60 additional lifetime reserve days. So potentially you could have 150 days in a row in the hospital and have it be covered by Medicare. Now, those 60 lifetime reserve days, once they're used up, they're gone. But those 90-day blocks, they keep regenerating once per calendar quarter. So that you never run out of those. Now, some of the things that Medicare doesn't pay for, it doesn't cover private duty nursing, or comfort or convenience items. Now, you might say, what's a convenience item? What's a comfort item? Well, so if you have a television in your room and there's a rental fee for that, they're not going to pay for that. Now, on that slide before, we said that Medicare A and B does not cover 100% of your expenses. So these are some of the gaps in the Medicare Part A. Medicare Part A, day 1 through 60 in the hospital, it pays all but the first $1,484 of that 60-day stay. If you're in for longer than 60 days in a row, day 61 through day 90, Medicare pays all but the first $371 of each day in the hospital. And if you're in longer than 90 days, day 91 through day 150, then Medicare pays all but the first $742 of each day. So you can kind of see it, the more serious the health situation, the longer the hospital stay, the less Medicare pays. Now, basically what will happen is that 90-day block, okay, is once per calendar quarter. So that $1,484 charge could only be due once per calendar quarter. So for example, if you go to the hospital in March and you're in for 5 days, there would be $1,484 owed. You're good until maybe July. That's a different calendar quarter. There's going to be another $1,484 due for that stay. So you can see why it's kind of important to have something else maybe pick up those charges that Medicare does not. Now, if you need some skilled nursing care and you've had a hospital stay beforehand, there's some specific rules for this. Day 0 through day 20 is paid for in full by Medicare. Day 21 through day 100, Medicare pays all but the first $185.50 of each day in that skilled nursing facility. And anything longer than 100 days, Medicare is not going to pay for. Okay, so you're fully responsible for that. And if you're in a situation like that, you're going to need some kind of resources, like either spending your own assets down or having some kind of insurance to protect in that situation. And again, this is only for skilled nursing care. It's not assisted living. It's not in-home care. So that's important to remember as well. And in a nutshell, that's basically how Medicare Part A works. So Medicare Part B, it is the medical side of things. It pays for the provider services. Now, how this traditionally worked in the past is the Medicare Part B premiums were deducted directly from Social Security checks. But now most people aren't taking Social Security at age 65. So if you're not on Social Security when you turn 65, then you will be billed for your Medicare Part B premiums until you actually do go on Social Security, and they deduct it directly from that. Now, if you qualify for the state Medicaid program, the state will pay the Medicare Part B premiums, again, for those people that meet very specific income and asset guidelines. Now, enrolling in Medicare Part B is very important to do at the right time, because this is the first spot where we see people make a wrong turn in the maze and potentially get in trouble. Now, Medicare says Part B is optional, but it's only optional if you have credible coverage from some other source, like an employer coverage or a union plan. And if you don't get Medicare Part B when you're supposed to, there is a premium of 10% for each full 12 months that you don't get it, that you should have it. And that's a lifetime penalty. Unfortunately, we run into some people that miss the enrollment. I had one person a few months back, maybe 6 months or so, that actually had missed the enrollment period by 12 years, so 120% penalty. And, and unfortunately, it's not that uncommon. We see somebody that thinks they have coverage that counts as credible, but they missed the enrollment, and they maybe have a 40 or 50% lifetime penalty. So it's very important that you make sure you enroll in Part B when you're supposed to. Now, the first time you're supposed to enroll in Medicare Part B is the initial enrollment period, and that starts 3 months before the month you turn 65. It runs through the month of your 65th birthday and goes for 3 months after you turn 65. Now, if you have credible coverage through an employer, you don't have to worry about that initial enrollment period. But when you're ready to come off your employer's coverage, you now have a special enrollment period where you can get Medicare Part B without any penalty. The only thing you have to do is submit a form to your employer to verify that you had credible coverage and turn that over to Medicare when you apply, and you'll get your Medicare Part B coverage with no reduction in coverage or no penalties because you've had that credible employer coverage. Now, if you miss your initial enrollment period, if you miss the special enrollment period, there's one other period of time each year where you can get your Medicare Part B, and that's the general enrollment period. It runs January 1st through March 31st of each year, and if you enroll during that period of time, your Medicare coverage will not start until July 1st of that year. So if you're signing up in the general enrollment period, you're pretty likely to be facing a penalty for late enrollment as well. So, we don't want you to do that. There's no reason to be subject to a penalty because as long as you follow the rules with this, you will not have to have a penalty. And again, we don't want that to happen to you. With Medicare Part B this year in 2021, the annual deductible is $203. So you have to pay that first $203 before Medicare pays anything. Now, after the $203 is paid, Medicare jumps in and pays 80%, and you're responsible for the remaining 20% if you have nothing else other than original Medicare A and Medicare B. So it's so important to get into Medicare Part B at the right time. We actually have a couple slides devoted to this. So during that initial enrollment period, you can enroll as early as 3 months before the month you turn 65. And we do recommend starting then in case there's some kind of roadblock where maybe Social Security has some incorrect information on file for you. That gives us plenty of time to get through that and make sure that your coverage starts the first day that you turn 65. Now, if you actually wait till the month you turn 65 or one of those 3 months after, your coverage could be delayed anywhere from 1 to 6 months after you enroll. So if you need the coverage, if you think your coverage is, your employer coverage is done when you turn 65, and if you think you can wait till 65 to enroll, you'll actually have a period where you have no coverage. So again, it's better to start early than, the week before. Now, during that initial enrollment period, you can enroll in any of the premium-free Part A plans, but you can only enroll in Part B, and if you have a premium for Part A during the approved enrollment periods. And again, if you don't enroll in your initial enrollment or special enrollment period, you will have a lifetime penalty. And one last time, if your birthday, 65th birthday falls during April, the earliest you can enroll is January 1st, and the last day you can enroll is July 31st. And again, during this period of time, you can choose any other kind of Medicare insurance plan that goes along with original Medicare during this initial enrollment period. Next thing we're going to jump onto is prescription drug plans, and we probably get more questions on the prescription drug plans every year than any other part of Medicare. That's because Medicare changes these rules and changes these numbers every year, so it's kind of a moving target. But once you go on Medicare, there's only going to be 2 ways to get your medications. One is through a standalone prescription drug plan that goes along with original Medicare. And the other way is through a Medicare Advantage plan. And that Medicare Advantage prescription drug plan, that's offered through a private insurance company through a contract with Medicare, and it actually replaces your Medicare coverage. So who is eligible for Medicare Part D? So pretty much everybody, anybody that's entitled to Part A and or is enrolled in Part B. The only thing is you have to permanently reside in the area where that plan is offered. So we have 30 plans here in Western Pennsylvania right now. Those are the only plans you can buy. So maybe you live in Florida part of the year and you see a plan there that you think is going to work better for you. If Florida is not your permanent residence, you can't buy that Florida plan. So the people that are the dual eligible, the ones that qualify for both Medicare and Medicaid, they can get one of these Part D plans. Now here's the thing, here's another penalty with a Medicare Part D. There's a higher premium for that if you wait to enroll for Medicare Part D, unless you have credible coverage from another source. So you don't need to enroll in Medicare Part D if you have a VA drug benefit plan, if you have an employer plan or some other type of pharmacy plan offered through your state. You don't have to worry about that. But if you don't enroll, the penalty is 1% per month, again, for a lifetime until you do finally enroll. And we run into this, unfortunately, because we have a lot of people that are more healthy at 65 than people were in the past. They may take no medicines, or they may only take a simple blood pressure medication or cholesterol medicine, and they say, oh, why should I have to buy a prescription drug plan when my medicine's, $2 at Giant Eagle or CVS or whatever? Well, the reason is, if you don't buy that plan when you need it, and even though your medicines only cost a couple dollars, by the time you do get a plan, it could be very expensive. I mean, again, we've seen 50 and 60% penalties there on that Part D. And again, there's no reason to face a surcharge or penalty if you don't have to. I mean, it's a game of the rules. If you follow the rules, again, no penalty. So Medicare Part D, this is how the standard plan works in 2021. In our area, all the plans seem to be following the standard CMS outline. So how it's supposed to work is they all have a $445 deductible where you pay 100% of the drug cost. But most of the good plans in our area, they waive the deductible for Tier 1 and Tier 2 medications. So most of those medications, if that's all you have, they're going to be $0 or maybe a few dollars a month out of pocket. Now, once the deductible is met, that $445, either through you paying it or your insurance company discounting it, you're in the initial coverage phase. That's that yellow area on the graph. And the initial coverage phase lasts until the cost of the medications has reached $4,130. And that's the amount paid by you and your insurance company. Now, during that initial coverage phase, you pay 25% of the cost of the medication. Now, once the cost of the medication reaches $4,130, you fall into what used to be called the donut hole. The donut hole used to be big and scary because you used to pay a much higher percentage of the cost of the medications during the donut hole. Now, it's exactly the same as the initial coverage phase. It's 25%. You're still paying that. What has changed is who's paying the remaining 75% when you're in the donut hole. Now, once the total that's been paid by you, the insurance company, and through drug manufacturer discounts adds up to $6,550, now you're in what's called the catastrophic coverage phase, and during that period on out for the rest of the year, you're only going to pay 5% of the drug costs. Now, again, this is a little bit confusing for people because it's a moving target every year. The deductible goes up. The percentages have changed almost every year up until this last year, and the true out-of-pocket cost. So again, we get a lot of questions. It's okay to not understand this fully. The most important thing here is to make sure you look at the drugs that you have and know what they're going to cost throughout the year, and we're able to calculate that for you pretty easily. So real quick, that was a real quick overview of Medicare A, Medicare B, and Medicare D. Now, this is what most people have come to the workshop for tonight is choices when picking coverage, like what should I do? I mean, what's going to be the right choice for me? And when we're picking coverage, there's two options that we can go through here. And one is the blue side. That's if you choose to stick with original Medicare and you get something to fill in those all buts or the gaps that Medicare doesn't pay for. So if you, first choice is if you happen to have some employee or retiree group coverage, you may choose to stick with original Medicare and have that employee or retiree group coverage supplemented. But you do have to check, because sometimes the employer or retiree coverage requires you to get Medicare A and B, and sometimes they have a drug plan and sometimes they don't. Now, if you don't have employer coverage available and you want to stick with original Medicare, then you can get a gap plan. And they all require you to have Medicare A and B. And in order to have complete coverage, you will have to get a separate prescription drug plan. Now, the other choice is you go and get a Medicare Advantage plan. Now, this is a private insurance plan that replaces your original Medicare. And these plans require you to have Medicare Part A and B as well. And right here in our area in Western Pennsylvania, where we're located, most of the plans are HMO or PPO plans. And most of those plans have prescription drugs included right along with them. So that's something you do not have to worry about. Now, if you're one of those people that's dual eligible, that has both Medicare and Medicaid, you can choose to get an Advantage plan as well. And most of those in our area are HMO. Now, this area right here is one of the first places where we see people make a mistake that could end up costing them unnecessary money in Medicare. And the first of those is, so maybe you worked for an employer for a long time, 20, 25, 30 years, and you had the same exact insurance company that whole time. You've used it, it worked well for you, you understand it, and the common sense thing would seem that you would just look at that insurance company when you're turning 65 and pick one of their Medicare health plan options. Well, the downfall there is those employer-based plans, the pre-65 plans, are designed for a whole different group of people than Medicare plans, and so they're designed for, young 20-year-olds. They're designed for families. And if you just limit your search to looking at that company's plans, you may have a very rude awakening when you turn 65 and end up with a plan that was totally different than your employer coverage. The other place where we see people make mistakes is they listen to their friend or their neighbor that's a couple years older. And it seems, I don't know why, we always pick on Sally, and I hope there's no Sallys in this webinar tonight. If you are, I apologize, I'm not picking on you. But say your friend Sally is a couple years older. She's gone through this whole Medicare journey already, and she seems to be pretty well educated and knowledgeable about Medicare, and she really convinces you very confidently to go with the plan that she has. Now, this could be the problem there. The chances are that your medications and your doctors are exactly the same as Sally is pretty slim. And, we have quite a few people on the webinar this evening. Not one of you probably go to the same doctor, have the same group of medicines, or even like the same health system. So you pick Sally's plan, and then January 1st or 2nd, you go to your doctor and find out that he doesn't participate. You want to go to your favorite hospital that you've gone to for the last 15 years. Well, guess what? They're not in network. So all at once, the plan that works great for Sally is not that good for you. Sally's doctor is a block away. Her hospital is 2 blocks away, and she never goes any further than downtown Pittsburgh, where you, on the other hand, may travel nationwide to see your grandchildren and like to vacation all over, and you don't like Sally's doctor or health system. So the takeaway from that is you want to figure out what's important to you and make sure that you select a health plan that checks off all those boxes of everything that you want to have in that. So Medicare supplement insurance, that's the first thing that we're going to get into. This is keeping original Medicare and getting something to fill in the gaps. Now, if you're going to write down anything, I'd like you to write this down for something we'll get into a little bit later. Right now in Western Pennsylvania, we have 60 carriers with the same exact plans. Now, we're going to talk about Plan G pretty much the rest of our time talking about Medigap plans tonight, because it's by far the most popular plan that clients end up with, and it's the most popular because it's the most comprehensive plan out there. So those 60 insurance companies, if they're offering a Plan G, the benefits all have to be identical. These plans are offered by strict guidelines under Medicare, and Medicare says that the coverage has to be the same. So when you're comparing these plans, you're comparing apples to apples, not comparing it to some different kind of fruit. So later on, you'll see why it's important. I told you to note that all the plan benefits are 100% identical. Now, there are 9 different types of gap plans, plans A through Plan N, that are identical in 47 states. There are 3 states that have different versions of these plans. And unless you're planning on moving to Minnesota, Wisconsin, or Massachusetts, we're not really going to get into them. And like I said, we don't really touch on those other plans that much. I mean, if you want to ask about them personally, we can get into them, but almost everybody goes with Plan G. And here's the reason for that. Like most of the stuff that you're getting in the mail, they're going to have this plan matrix or plan grid on of all the available Medigap plans, Plan A through Plan N. And those gaps we talked about, the things that Medicare didn't cover, those are all of these blocks. And I apologize, we jumped ahead a little bit too soon there. Okay. As long as a check mark is filled in, that gap is paid for by the Medigap plan. And you can see that there's only one block that's not checked off. That's a Medicare Part B deductible. So the way the Plan G works, once you pay the first $203, the Medigap plan kicks in and pays 100% of the remaining expenses. So the next thing we're going to get into is the Medicare Advantage plans. And these are plans offered, again, by private insurance companies through a Medicare contract, and it actually takes the place of your original Medicare. Now, we're based here in Western Pennsylvania, and we're talking about some of these plans particularly in this area because that's what we have the most experience with. So in Allegheny County, we have plans offered by 7 insurance companies, and there are 45 different plans. Both Butler and Westmoreland County have the same 7 carriers, but they have extra plans. Now, we like to say in Western Pennsylvania, we're both blessed and cursed. Now, we're blessed because we have a lot of good doctors. We have 2 great health systems, but we have a lot of plan choices. We have 45 different plans to pick from, and that makes it extra confusing. So that's the curse. Most areas of the country, they might only have 12 plans to pick from. Average nationwide is 28. So, we have a whole bunch of extra plans to sort through and pick through. So that's the curse, and that can make it a little bit more confusing. But again, it's good to have choice sometimes. Now, getting into an Advantage plan, there are only certain times that you can get into an Advantage plan. And the first of those is the initial election period that falls the 3 months before the month you turn 65 and 3 months after. And during that period of time, you can get into any Advantage plan or prescription drug plan. The other period of time you can get one of these is during the annual election period, and that's runs from October 15th to December 7th. You know when this is because as long as it's not election year, every single commercial on television is about some kind of health plan by some celebrity showing you something that you should get, and it's the greatest thing. Now, if you sign up or change during this period of time, your coverage will take effect January 1st. And there's one other time, it's kind of like your do-over, and it runs from January 1st through March 31st, and it's only for people that already have a Medicare Advantage plan. Now, during the open enrollment, if you already have Medicare Advantage plan, you can switch one time to another Advantage plan, or you can go back to original Medicare. The annual election period is if you have original Medicare or an Advantage plan. Now, the one thing that is important to mention is as long as you're in a valid enrollment period with a Medicare Advantage plan, they have to accept you in the plan without any kind of health questions. So you could be very unhealthy and switch one of these plans as long as you're in a valid election period. With the Medigap plans, The first period of time that you go into those during the initial election period, they can ask no health questions. But after that, if you decide you want to switch plans or go from an Advantage plan back to original Medicare and a Medigap plan, there will be health questions. You have to qualify based on your present medical condition, and you can be turned down. So before you make this jump from a Medicare Advantage to a Medigap, you do want to make sure that you qualify first before you make that switch and end up with nothing. Now, there's one other period of time. It's a special election period, and that happens if you move from this area to another area of the country. You get to pick one of those Medicare Advantage plans in that new area, and sometimes, and it happens, it's rare, but it does happen, one of those 7 carriers may decide to drop one of their plans, and if you're one of the people that have that plan, you get to pick a new plan without any penalty. Now, this is one of the reasons people come to the workshop. They want to know, well, why should I pick a Medigap plan? Why should I pick a Medicare Advantage plan? So we're going to put the differences down side by side here. So if you stick with original Medicare and a Medigap Plan G, the benefit of that is that all doctors and all hospitals in the U.S. Will take that. As long as they take original Medicare, they're going to take the Medigap plan that goes along with it. The Medicare Advantage plans, there are networks, okay? The doctors and hospitals are in specific networks. If you go the HMO route with the Medicare Advantage, it requires you to stay in the network. The PPO plans will let you go outside of the network as long as you agree to pay a little bit more to leave the network. With the Medicare and the Medigap plan, there are no copays. Okay, once you paid the premium for the month, there's no copays each time you see the doctor or go to the hospital. With the Advantage plans, there are copays. It's a shared expense plan. And there's not one of these that's better than another. It's what's best for your particular situation. Some people like the Medicare and the Medigap route. Others like the Medicare Advantage. With the Medicare supplement or the Medigap and plan, there is the Part B deductible that you have to pay, that $203. With the Medicare Advantage plan, there is no deductible for most of the plans in our area. There's 1 or 2 that may have a deductible, but again, most of them are $0 deductible plans, so that means the insurance company starts paying right away for your care. With Medicare and a Medigap plan, there's no out-of-pocket once the deductible's met. And with the Medicare Advantage, there will be out-of-pocket expenses, and that will vary by the plan you choose. Okay, again, it's a shared expense plan. If you go to the doctor more, you're going to have more out-of-pocket expenses. On the Medicare Medigap side, you must add a prescription drug plan unless you have credible coverage somewhere else. Okay, with the Medicare Advantage, the prescription drug plan is usually included. So why do people pick a Medicare and Medigap choice for their health care coverage? Well, the number one reason is the freedom of choice. They like the fact that any doctor anywhere in the U.S. is going to accept that coverage. They like the fact that there's no copays and there's no referrals required. The other thing here is you can pretty much figure out what your budget is. You know what your premium is. You know that you have your Part B deductible to pay, the cost of your drug plan and any drug copays. And if you're a stickler for budgeting your expenses each month, the Medicare and Medigap route is a much easier way to do that. Now, the Medicare Advantage plans, why do people like those? Well, the most popular reason that people like the Medicare Advantage plans is a lower monthly premium. Okay, some of these plans, and they're good plans, have a $0 premium and have really good coverage. Again, they are shared expenses plans, and they're okay. The people that select them are okay sharing expenses because they know their premiums are lower each month. They may be happy that the doctors and hospitals they already go to are part of the network that they select. They like the fact that there's a prescription drug benefit included, and in their mind that makes the plans simpler and easier to use. Next, I'm going to get into where you get your information. I said it's earlier, it's important that you make sure you get a plan that meets all of your needs and covers all of your needs. So there's going to be two ways you can get plan information. One is from an unbiased advisor, and the other is going directly to an insurance company, whether calling them, seeing somebody in a kiosk in the mall, or calling one of the agents that work directly for them. So with an unbiased advisor, and I like to talk about us here because we represent all the companies. We don't care which company you decide to go with because we represent them all. So the unbiased advisor will represent all the Medigap, Medicare Advantage, and prescription drug plans. Whereas if you go directly to an insurance company, they're only going to present information on the plans that they offer. So it's limited choice. The unbiased advisor, that we're going to find out what your personal needs are, like who your doctors are, what's your medications, do you plan on traveling, those kind of things. And, where on the other hand, that single insurance company, they're going to tell you about the plans, again, that they have and how close they can come to covering what you need. Once the unbiased advisor finds out what's important to you, they'll come up with a personalized coverage plan, and you'll get to select the best options from all the carriers. With the individual insurance company, again, limited choice of plans. They're only going to go over the plans offered by that company. Now, the unbiased advisor, you get to compare different plans from different carriers. You'll be able to say, well, what if I go from an Advantage plan to a Medigap plan? Or what if I decide that I don't want to pay that much each month? What would happen if I go to a $0 plan? You'll get to see those choices with an unbiased advisor. Whereas a single insurance company, you're not really going to have that option for comparison because some of these Medicare Advantage plans don't have Medigap plans even available. And the other thing is they're not going to share maybe a competitor's plan that would work better for your situation. What I always like to say, it's similar to you're out car shopping or maybe truck shopping and you find yourself on a Ford dealer's lot. Well, you're talking to the Ford salesman and he's going to tell you everything about that Ford F-150 pickup truck and why it's the best for you and why you should drive it because that's what all the smart people drive. Whereas the thing that you may really need may be on a Dodge Ram or a GMC. And that guy at the Ford lot's never going to tell you about that thing that actually works better for you and is going to fit your needs better. And again, so that's why we think that you should have all options available to you. Now, the unbiased advisor is going to give you annual personalized follow-up because people's needs and situations change. Maybe your health is not as good next year as it is right now. Maybe you're planning on a move. Maybe you've come off of some medications, or maybe just the medications that you're on, the cost have changed. And that happens quite frequently. Your medications are all real affordable, and next year the plans change, and the plan that you're on now where the medicines are $0 once they're $47. So it's good to have that annual follow-up to make sure that you're not overpaying and getting all the benefits that you're entitled to. Now, if you go directly to an insurance company, the only thing you're going to get from them is the annual plan update. What's your plan going to cost next year and what benefits have they added or taken away? The other thing we like to bring up is the difference between dealing with a local advisor, somebody that knows the carriers that are available in that local area, as opposed to going to somebody that's outside of your local area, maybe in Florida or Kansas City or Los Angeles, okay? Because, sometimes you're filling out postcards, filling out information online, and somebody calls you and they're nowhere near you. So the local advisor, again, we're talking about us. We have years of experience in the local Western Pennsylvania market, like literally almost 100 years of experience with all of our advisors knowing what's going on with all the local carriers. The other thing is we talk to our clients. How did your plan work this year? How's your experience with your carrier? Are you able to get through to them on the phone when you need them? If you come up with a problem, did they solve it easily? We know that for which carriers are good and which carriers are not so good. Whereas that distant advisor, they're going to have limited knowledge of any market because they're selling these plans all across the United States. There's something like 1,700 of these Advantage plans offered all over the country, and they're not going to know anything about any client's experience in any local area. Again, the local advisor, we have access to all local plans information, and we can offer a plan choice through any insurance company that you decide that you happen to want. That distance advisor may only have access to a few companies, and again, they'll tell you about the choices that they have available. The local advisor can show you details of all the plans. There's no incentive to offer one plan over another. Just as long as you get the right plan, that's what makes us as the local advisor happy. Whereas that distant advisor, again, there's going to be a limited choice of plans, and they may have a flavor of the month where they are incentivized to mention certain carriers and not mention other ones. Here's the most important thing. You can find us when you need us. Okay, we're right here in the North Hills of Pittsburgh, right off of McKnight Road. We have a lot of clients come to our office each week. We're able to meet people virtually. We have advisors that live all across Western Pennsylvania. And if you can't do virtual and can't make it to our office, I'm sure we can get somebody to you locally to help you out. So you know where to find us when you need some kind of help. Whereas that distant advisor, the most important question is, where the heck are they? They could be thousands of miles away and have turnover and new agents all the time. Whereas we've been here a long time and we don't plan on going anywhere. Local advisor, again, that annual personalized follow-up is very important, just to make sure that you're always paying the lowest premium and getting the most benefits that you're entitled to. Whereas that distant advisor, there's most likely going to be no follow-up unless they have something new that they can sell you at that point. So one of the other things that people feel is very important is, what's it going to cost me? That's the big unknown when you go on Medicare and get one of these Medicare health insurance plans. So we're going to compare these, the Medicare and the Medigap plans side by side with the Medicare Advantage. So both require you to have Medicare Part A, and that Medicare Part A will cost you nothing as long as either you or your spouse have an adequate work history. Medicare Part B, they both require you to have Medicare Part B. So the vast majority of people, the Medicare Part B premium in 2021 is $148.50. Now, if you're a high income individual and your income is beyond a certain limit, there are surcharges for the Medicare Part B. And if you have questions or concerns about any of those, you can shoot us an email. You can say, or call us, say, I want to talk about that in private to see what that Medicare surcharge may be. But regardless of which route you go, with a Medicare and Medigap or Medicare Advantage, they both require you to have Medicare Part B. Now, I apologize there. We're having technical issues with the slides tonight. Okay, so the Medigap Plan G, okay, what's it cost? Now, I told you to write down earlier that the Medigap Plan G, they all have the same set of benefits. Okay, so the benefits are going to be identical. And in our area, Medigap Plan G costs anywhere from $99 the whole way to up to more than $200. Okay, and the benefits are the same in that $200 plan as they are in the $99 plan. And the only reason I could see that somebody ends up with a $200 plan and not a $99 or $110 plan is they weren't told that the plans are identical and that there's a plan out there that doesn't cost $200. Okay, so again, it's very important that you have access to all the information when making that decision so you don't overpay for the same benefits. On the Medicare Advantage side, there's lots of good plans that have a $0 premium. Okay, there's also plans on the Medicare Advantage side that cost more than $200. And the same thing, that $200 plan sometimes has less benefits and less coverage than a plan that costs $0 or $29. And the same reason a person would end up with that $200 plan is somebody didn't show them, put the benefits side by side and say, hey, you're not getting anything extra for this extra $180 that you're spending. Okay, so again, it's important to have access to all that information when you're making this plan choice. Now, Medicare Medigap side, you have the Part B deductible of $203 you have to pay. On the Medicare Advantage side, there's no deductible for most of the plans that we see people go into. Medicare Part D average plan runs anywhere from $7 to $21 on the Medicare Medigap side if you need that separate standalone Part D plan. On the Medicare Advantage side, most of those plans have the drug coverage included, so there's no extra expense for that. So again, we're looking at the Medicare Medigap side. What's the monthly expense? So if you're a budgeter, again, it's easy to add up the $148.50. The cost of the Medigap premium, the $99 to $110, and if you use the doctor, the $203 deductible and your drug expenses. On the Medicare Advantage side, it's a little bit more difficult. You have your $148.50 that you have to pay for Medicare Part B. Now, if you don't go to the doctor a lot, your expenses are going to be very minor. The more you go to the doctor, the more you need hospital services, the cost sharing will go up, and that's where, if you're basically healthy, that's why people tend to look at the Advantage side. If people have more health needs, they sometimes like to go the gap route. Okay? So again, when to enroll in Medicare. We talked earlier that it's very important to get in to Medicare Part B the right time. And we normally see three situations of when to enroll in Medicare. So the three situations: if you're still working and covered under your employer's group plan. The second situation is if you're already collecting Social Security benefits. And the third is if you're not already collecting Social Security benefits. So if you're still working and you're covered under your employer's plan, you have choice. Option one is to stay with the employer group coverage, and you can delay your enrollment in Medicare and have no penalties, no loss of options. Now, up to about 2 years ago, we universally almost always recommended that people stay with their employer coverage and delay enrollment in Medicare because in that up till that period of time, the cost was pretty good and the coverage was pretty good. But what we've seen happen over the last 2 years is the cost sharing has gone up. The employers are making the workers share more of the cost of the insurance coverage, and the coverage is less. So there's a higher deductible, higher co-payments, and out-of-pocket maxes. It's not unusual for us to see an employer coverage have a $2,500 deductible and maybe a $6,500 individual out-of-pocket max, or maybe even $11,000 in a high deductible, high out-of-pocket max plan. And with the cost sharing, what we've been seeing more and more often is it's less expensive for people to take a Medicare plan and go off their employer coverage as soon as they're able. Now, the thing you do have to take into consideration here is, do you have a spouse that may be younger and needs that employer coverage? But we've even been seeing lately where it's still less expensive for the employee to come off of the group coverage, take Medicare, and get private insurance for their spouse, sometimes saving as much as $400 or $500 a month with certain employer coverage. Now, if you decide to leave the employer group insurance, you will enroll in Medicare and so then select either Medigap or Medicare Advantage plan. Now, if you're already collecting Social Security, this is probably the easiest situation for people. The Medicare enrollment in your Medicare A and B happens automatically. Social Security will pass the information along to Medicare, and about 90 days before, you should get your Medicare card. Now, if you have the option of some employer or retiree group coverage, you can choose to delay that Medicare Part B enrollment. You would just flip your Medicare card over, sign where it says you don't want Part B, send it back, and they'll send you a Medicare card with just Part A on it. But again, we do not see that happening as often as we used to, because with some of the plans offered, especially just this year, it's way less expensive for people to take Medicare and some kind of Medicare health insurance plan. And if you decide to leave Medicare and get some Medigap or Medicare Advantage plan, you can choose that option as well once you decide to leave the employer coverage. And finally, the third option is if you're not already collecting Social Security. And we're seeing this more and more often because most people don't take Social Security at 65. They're waiting till full retirement age so that maybe they can continue to work some. Maybe they like working. Maybe they want to delay it to maximize their Social Security benefit the whole way up to past age 70. So in that situation, if you want Medicare right away, then what we recommend, and this is the absolute easiest way right now with everything that's going on with, some of the pandemic closures, is to go directly to the Social Security website. And that's at www.ssa.gov to enroll in Medicare. We strongly suggest, and I do say strongly, that you start this 90 days before the month you want Medicare to start, because we have run into some issues with people getting locked out of their Social Security account. Maybe some of the information's wrong. Maybe they were somebody tried to steal the person's identity, and you want to know all these things beforehand so your Medicare can start right the first day of the month that you turn 65. Now, when you go to that SSA.gov site, you click the blue box where it says Medicare and has a picture. If you're not totally confident that you can do this and jump through all the hoops through Social Security, we are more than glad to help you do this process, get enrolled in Medicare. And sometimes we do this 5 or 10 times a week, and we're happy to do it. I mean, we can almost do it in our sleep. We do it so often. And if we run into one of those roadblocks, we can direct you the right way to get through it by the time you turn 65. Now, the important thing you want to do to verify that you've done all the things you're supposed to enroll in Medicare and you never have an issue with possibly facing that penalty is when you get to the last page of that enrollment, you select the print this page option and save a couple copies of it. When we do it here in our office, we'll print 3 copies. We'll give you 2. Say, put one in your fire safe, hide one away under your mattress, and then we keep the third one here in your chart. Because what used to happen is people used to make appointments with Social Security, go into the office, and then in that Social Security office they'd put you on the phone to enroll in Medicare. Well, you wouldn't have the option to print that screen, have the verification that you actually went on Medicare, and now they're just doing the appointments with phone calls. So you want to make sure you have that verification in order to make sure that you've done everything at the right time. And finally, once you've enrolled, you can select your retiree group insurance if you have that available, or select your Medigap or Medicare Advantage plan. Now, it's important websites for Medicare information. The first of those is Medicare.gov. Now, again, it's a very useful website. It's well put together, but it's pages and pages of information, all kinds of special situations, and it's not entirely the easiest to navigate. But again, everything you want to know about Medicare will be on there on that website. Now, the My Social Security website is actually a very good website. It will have all the benefits that you've applied for, your Social Security benefits, your earning history, and when you do apply for Medicare, it will have all of that grouped in one place for easy access for you. And finally, the Mymedicare.gov. It is a good website as well. It will have all of your Medicare information. It will have prescription information, what your doctors have prescribed for you. It'll have sometimes your claims history. It might not be complete, but it will be a good place to find all that information on your doctors if you can't remember a doctor's name. Maybe a prescription if you can't remember when you got it filled. So again, those are good websites, and they will be available for you to have all that information. So who remembers this person here from back at the very beginning of the maze? Now, we hoped that because you've been at this webinar tonight, it's giving you some good information. You have some more confidence that you can make it through to the end point of the maze. But you still have a lot of decisions facing you. You may not be entirely certain that you're going to make it through without some twists and turns, hitting a dead end and having to backtrack. Well, again, that's where I joked at the beginning. We have the map to the maze, and we really do have that map to the maze. And I'll tell you a little bit more about that in a second. Now, we have people here, all ages right before 65. And we might have some people that are a year before 65 or only a couple months. Well, it doesn't matter where you are in that time frame. It's good to, maybe start figuring out your options. In this picture here, we have the happy couple at the end of the maze. We say they're happy because we've guided them through with that map. But I'll tell you, once you've, got the information in front of you, you made that decision, it gives you some peace of mind, it gives you some confidence. You can stop worrying about all that mail you're getting. You can stop worrying about your decision because you kind of know the path that you have to be on. Now, something important that we do is we offer everybody that's come to one of these webinars a Medicare Done For You visit. And these are some of the advantages we have available to us, why we think that Medicare Done For You visit is very important and very unique. Now, we have some proprietary software. It's exclusive to us. We're actually part of a much larger organization that we have close to 1,000 advisors across the United States, over 40 offices in cities nationwide. And our home office has come up with this specialized software for us. And what it allows us to do, it allows us to find out all the important information about you or for you, who your doctors are, what medication do you take? Where do you like to travel? What health system do you want to stay in? And we can take that information and put this in our system, and it will help select the least expensive plan that has the most benefits for you. And again, this is something that we only offer. Now, we've had some people come interview in our office, come work with us, come from other places, and they have not seen this technology before. And this is what makes our job easy. It makes it easy for us to help you. If we didn't have this available, we'd be basically putting all that information on over 100 plans down on our conference table and trying to figure it out. And that's what some of these other people that do this job have to do. Whereas again, we can put this information together, put it up on our screen and show you what your options are. Now, once we've done that, we also have a second piece of exclusive technology where we can compare the strength of the health insurance plans. How many people is covered in that plan in Pennsylvania? Because a lot of times it's numbers. It's a numbers game. The more people that are covered, the more stable the premium is going to be on that plan and the more better benefits you get. Now, we have two Medigap plans where the prices are almost the same. One is $138.06 a month, and others $138.18, whereas the one plan only has 5 people in Pennsylvania in that plan, whereas the other plan has 720. So, that's just information you don't have access to. And we're not ever going to recommend that you go into a plan that only has 368 people nationwide have that coverage, just to save you a few pennies. We're going to recommend a plan that has a good group of coverage, so you have stable prices, and so you have the best set of benefits possible. So again, how we do things different. We're going to present full details of all the choices. Again, we represent all the companies. We're unbiased. We always say we don't care which plan you pick. We want you to make the choice that's right for you. We don't look at this as like a one-night stand. This is a long-term relationship, because if you like what we do for you this year, you'll be back next year, and hopefully you'll share your success with the people around you, the people that are important that you care about. Here's one of the most important things I think we do is that Medicare done for you service, and it cost you $0. Now, we've had some of our advisors here in the office that have just recently turned 65, and I'll be truthful with you, we're Medicare geeks. Okay, we look for all the information on Medicare that's out there. We look at everybody else doing this, and some of our advisors have sat through these webinars and seen the Medicare Done For You service offered at $500, okay? And that's just not for both husband and wife, that's for one person. And then the annual review, they're charging $250 for. Now, we do it for $0. And the reason for that is we want you in the right choice. And when it comes down to it is once we've shown you the right choice and we assist you in enrolling with a particular carrier, then that insurance company pays us for the Medicare Done For You service that we give for you. And that's, again, as long as we help you process that enrollment and get with that insurance plan, then, you know, the insurance company will take care of that. And that's how we are compensated. So again, the one thing I do want to say, it's more important that we get you in the right plan and don't really care so much which plan we get you into. And when we do the Medicare Done For You, we offer this Navigating Medicare booklet. It's 20 pages. It's pretty detailed, but it's compact, and everything that's in that 138-page Medicare booklet's in here. And when you sign up for the Medicare Done For You service, then that's when you will get this Navigating Medicare booklet. So we're going to open this up for questions here, and we're going to open the chat up in just 2 seconds. And while we're going through the chat, we're going to have the opportunity to schedule directly. Just look for the Schedule Now button right up at the top. And when we are done with this workshop, then we will have the you will have the opportunity to schedule with us, and you will also be getting an email with our contact information. Okay. So, Dr. Jim, if we sign up for something now, are we committed to it, or can we switch if we find something better? Well, absolutely. Okay. I mean, so if you're coming up to age 65, you can kind of make, you know, as many choices as you want coming up to that 65. And then during that annual election period, you know, we look for a better option for you there. You can definitely change plans from year to year. And you're not locked in. Now, if you go with an Advantage plan, you will be stuck with it until the next election period. There's no getting out of it. The Medigap plans, you can literally change those from month to month. And I do want to say, if I don't answer a question in enough detail, just tell me, I want some more detail or clarify the question. Now, did that answer what you were asking, Dr. Jim? I hope it did. Okay. So if we help you sign up for Medicare Part B, is there a charge? That's a good question from Fred there. No, there's no charge for that. We will normally do that right along with the Medicare Done For You, the visit where we're getting the information on who your doctors are, what your medicines are. You know, we'll find out if you've enrolled in Medicare, because the thing with these Medicare plans, they will not let you move forward unless we have that valid Medicare number. So we want to get that pretty early in the process so that we can get your Medicare started as soon as you want. Okay, again, we want to let you know that as soon as you schedule, we get this Medicare Navigating Medicare booklet. So, Vincent, so you are eligible to enroll in HOP versus via PEASers. Where does it fit in with Medicare? So that's a really good question. So HOP is a private insurance plan. They do offer private Medicare Advantage plans and their own HOP medical plan. We've run into it quite frequently, and what used to be the case was the HOP offered very comprehensive, good coverage at a reasonable cost. Now, over the course of time, the HOP coverage has gone up, and we've seen a lot of private Medicare options that people select over the HOP plan, and it's gotten to the point where many people that have that available leave HOP and take something else. So HOP is a private option. if you're in HOP, you can only get out of that and go back to the original Medicare Advantage plans during that annual election period, October 15th to December 7th. You're not available to switch out of that in the period January 1st through March 31st. Is that a answer to your question, Vincent? Okay, what would determine if I stay with my employer-supplied health care? Okay, and this is from Barry. So what normally we will look at there is we will, part of the Medicare Done For You process, we'll ask you to, come up with information on your employer coverage. And we'll put that employer plan side by side with the Medicare options. So what we normally would see that would make someone lean towards Medicare is if they have high cost sharing. You have a couple $100 per pay coming out of your paycheck to help pay for that employer health plan. If maybe you have a high deductible before the insurance company starts paying, like anything, say over $1,000, and if you have an out-of-pocket max that's, say any more than $3,900, that would start making me consider a Medicare health insurance plan for one of my clients in that situation. So again, we want to look at that very importantly. The other thing is if you have a spouse that has that needs that employer coverage, we'd look at the plans available in the open marketplace to see if we could save the both of you some money and get you a better set of benefits. Susan, that's a great question. So at what point before your 65th birthday would it be a good idea to schedule? Anytime, you can get in here anytime, but if you're planning on having us do the Medicare enrollment help with that, we want you to schedule about 4 months before you turn 65 to get you right in, at that 90 days before. But I mean, if you want to get information and you're more than 4 months out, we're happy to show you the options that are available so you can kind of, again, put your mind at ease and stop worrying about all of that mail that's coming in and all of the craziness and confusion that goes with that. Because, we still have people that will try a second guess and hear something. And again, the nice thing with what we do, not to ramble on, is we have all the plans available. So, if you give us the information, what's important to you, you can rest assured we're running it through all 7 companies with the Advantage side and all 60 companies with the Gap side. So, Barry, you're certainly welcome with that answer. Susan, did we get you answered there? So with Medigap plans, yeah. So Fred, that's a good question there. Can you go to any doctor? Yes, as long as that doctor accepts original Medicare, you can go use the Medigap plans there. We only run into a few situations with some cosmetic surgeons, a very few specialized sports medicine orthopedists, and pediatricians that don't take the Medicare. So of course, you're probably not going to be going with them anyways for your normal health care needs. We get that answered, Fred? Okay. So Dr. Jim, they started taking $144 out of my Social Security check every month. And this is a fantastic question. I'm so glad somebody asked this tonight. You've seen advertisement where there are plans that will restore the $144 per month back. Is this legit or a marketing ploy? Well, in Western Pennsylvania, we think it almost borders on the being dishonest because it's not valid information for Pennsylvania, Western Pennsylvania especially. And if you look at the fine prints on those commercials, it says not all plans offered in all areas. There is no plan in Western Pennsylvania right now that somebody that's not dual eligible and on Medicaid can get. The best that we have is we have some plans for veterans that you have a $40 give back to the $144. We have some non-veteran plans that will give maybe $50 back, but the benefits are not very good, and normally it's not a good trade-off to get that $50 back for as much as the benefits are reduced. Now, this is a very competitive area of the Medicare Part B give back. Just because of the marketing, it's going to make some of the Western Pennsylvania carriers look at it, and I expect to see more of those be offered for the 22 plan year. So yeah, so you can rest assured because you're not getting your 144 back, you're not getting scammed. There's nothing like that available in the Western Pennsylvania area right now. Okay, Debbie. Good question from Debbie. You were told that Medicare looks at your earnings from 2 years ago when deciding what to charge you. Is this correct? You're asking because during that year you made an abnormally high amount of money, okay, but last year you made much less. So how do I avoid paying this premium? Okay, so what they're normally saying with that 2-year look back is they're looking at the last available tax return. And for most people, that's a 2-year-old tax return. If you're applying right now and you haven't done your tax return for 2020, the most recent tax return they would have available would be 2019. So they're looking at that. If we get a little bit later in the year, say June or July, then they would have the 2020 tax return available to look at, and they would base it on that number. Now, we do have people that run into this situation and they have 1 year of unusual circumstances with an abnormally high income. Maybe, we had one guy that hit the lottery, and that's a once in a lifetime occurrence. At least it is for most people. Or maybe you had to sell some stocks, or you got an inheritance. And in situations like that, we recommend that you appeal that, you request a review of that, and if you're uncomfortable with that, we can help you, get you the appeal paperwork, assist you with filling that out, because if you can verify that it's a one-time event, it's not an ongoing occurrence, and especially with last year, we've had people take a drastic hit to their income with the unemployment because of COVID, because of business shutdowns, those types of things, and if you were maybe struggling a little bit last year, you don't want to have to pay a large extra amount for your Medicare Part B because 2019 was unusually good. So yeah, Debbie, that is correct. But if we have a 2020 tax return available, that when you actually get your Part B benefits, that's helpful. And if you're still hit with that surcharge, we can assist you with that appeal. Hope that answers that question. If not, just let me know. Okay, so we have another question being typed up. Again, we're going to give you as much time as you want. We'll stay as long as we need to tonight to make sure the questions were answered. Again, you schedule a Medicare Done For You visit. Once you come in, or we do that virtually, we do, you come in, we'll give it to you when you're here in the office. If we do it virtually, we'll email you the hard copy of that. Debbie, you are certainly welcome. So your 60 birthday, you're saying you're not going to need that information until November. We may be good there. Okay, so Dawn, so currently you're on Social Security only now, and assistance is available with the low income. You're paying $55 premium for UPMC insurance now. Will you have a much higher premium? Well, Dawn, I would have to say, we'd see if you qualify for any special help, but there are plans out there with great benefits where the premium is even lower than that UPMC plan. I'm not quite sure where you're located, but we have some real good plans in Allegheny County here. Run anywhere from $0 to $29 a month. And if you're outside Allegheny County, but in Western Pennsylvania, we have plans with awesome benefits that aren't any more than $49. So, save a couple dollars a month and probably get a higher level of benefits than you have with that current UPMC plan that you have right now. And then if you do qualify for some help based on this, Social Security, then there's even better plans than the ones I just mentioned. So how can you contact offline? So Dr. Jim, so as soon as the webinar is done, you're going to be taken to a page that's going to have our contact information. We're going to follow up with an email with a recording of our webinar. If you missed anything tonight, you'll be able to go back to that recording and refer to that, and that will have our email address, our website address, and our direct line to myself or one of the advisors here in the office. And we're more than happy to take your call and discuss whatever you need outside of the webinar here. The other thing is, too, I see that our Schedule Now link, if you want to schedule some time with us, I'll renew that and confirm that back up there. That will take you directly into our schedule, and you'll be able to get a time with us to, either talk in person or virtually. I will say, once you go to that Schedule Now link, it will give you a choice of 2 times. You do need to select, 2 choices, because we have people going in there and trying to schedule time simultaneously. It messes everything up. So, you select 2 times that you want, and then we'll get back to you and confirm one of those. Okay, so any other questions now as we're wrapping things up? So again, I want to thank everyone tonight. If nobody else is typing questions, we're glad you could join us. We're glad you were able to join us for this virtual workshop. We will be live starting in some of the local venues here in the Pittsburgh area coming up in April. Those will be posted on PittsburghMedicare101.com, which you will have access to once the webinar is over tonight. So if you want to see us in person, they'll be on our Facebook page. And again, we will have information on those out there. And again, we love to see you in person. Like I said, that's one of the most exciting things for us, is when we get out to see people live and talk to them in person.